Let's discuss about the Hashmoto thyroiditis. And we know this is the Hashmoto thyroiditis is most common primary cause for hypoparathyroidism. And it is more commonly occurs in case of females than that of males. It also can occur in males, but it is more common in case of females. And it can occur in any age group, but most commonly we say it is middle-aged women, but it can occur in any age group, women. Particularly it is more common in case of females. And this condition, Hashmoto thyroiditis, is often associated with the other autoimmune disorders like type 1 diabetes mellitus, vitiligo, psoriasis, pernicious anemia, and other APS type 2, where Hashmoto thyroiditis is more common than that of the Graves' disease. And it also got HLA association like HLA DR3, DR4, and DR5, and other. And this Hashmoto thyroiditis is a pre-malignant condition, must be noted, and it can progress into extranodal marginal zone lymphoma, or there is high chances for turning in and also into the papillary carcinoma. So hence this Hashmoto thyroiditis is a pre-malignant condition. And let's see the autoantibodies which are responsible for this Hashmoto thyroiditis. Autoantibodies which are implicated are the anti-TPO antibodies. TPO is nothing but thyroid peroxidase enzyme. So anti-TPO antibodies, anti-TSH receptor antibodies, anti-thyroglobulin antibodies. So these three antibodies can be seen, but is more commonly what we see is the anti-TPO antibodies in 100% of the case with the Hashmoto thyroiditis. And what are the clinical features we see in case of Hashmoto thyroiditis? That is nothing but a hypothyroidism patient. In case of hypothyroidism patient, it is a more common cause in case of females. Main clinical features like there will be lack of concentration, fatigue, and also weight gain will be there. In case of females, menstrual irregularities will be there. Like initially it will start with polyamenorrhea, later on it turn into oligoamenorrhea, and also finally into the amenorrhea. So menstrual irregularities can be seen in case of hypothyroidism. Weight gain will be seen, cold intolerance will be seen. So all these symptoms like lack of energy, lack of concentration, so these features will be seen. What are the signs we commonly see are that the cold peripheries, bradycardia, and the investigations which help for this hypothyroidism is that we all know that thyroid function test TFT will be done. What will be looked for is that we often look low T3 T4 levels and high TSH levels will be seen. And if we find low TSH levels and normal T4 levels, it is a subclinical hypothyroidism. Whereas in case of primary hypothyroidism, which is a clinical hypothyroidism, we often see low T3 T4 levels and high TSH levels. And this high TSH levels is mainly responsible for the accumulation of the glycosaminoglycans, which is responsible for the accumulation of the water, which results in puffiness, periorbital edema, and also other edematous features are mainly because of the high TSH levels. And the treatment which is available for this Hashmoto thyroiditis is, we all know that L-thyroxine tablet which is given, and this L-thyroxine tablet to be taken on empty stomach, and after taking this tablet, after 30 minutes we can take the meal. And what are the complications, and in whom these L-thyroxine levels or drug increased concentrations to be given, the patients who are taking the carbamazepine or phentoin and other drugs which interfere with the metabolism of thyroxine. In these patients, high dose of L-thyroxine to be given. Even in the case of pregnancy also, even in the patients with some GI disorders also, we need to increase the dose of L-thyroxine levels. And also even in case of patients who are taking the iron tablets like ferrous sulfate, in these patients also because these tablets will interfere with the absorption of the L-thyroxine, so high dose of the L-thyroxine has to be given. And also what most common cause for the treatment failure is the intolerance. So when patient is not taking the tablet, when patient is not adhering to the instructions, then what will happen is that any long-standing Hashmoto thyroiditis, and when the patient is not compliant with the drug, then which leads to treatment failure, and these conditions will often land up into the fatal condition called myxedematous coma. In case of myxedema, the patient presents in an unconscious state. So on the treatment which is available is the L-thyroxine has to be replaced. So main thing is that the main advice for these primary hypothyroidism patients is that always has to be adhered to the L-thyroxine tablet. So if you don't take the tablet regularly, if you're not adhering to the complaint with the treatment, then there are more chances that a long-standing Hashmoto thyroiditis or a very long history of Hashmoto thyroiditis will often land up into a very dangerous condition called myxedema, or other complications I already said, like carpal tunnel syndrome, or any long-standing Hashmoto thyroiditis may land up into it's a pre-malignant conditions, may turn into papillary carcinoma, or may turn into a non-Hodgkin's lymphoma like extranodal marginal zone lymphoma. And this is about the Hashmoto thyroiditis, which is most common primary cause for the hypothyroidism in case of females. And thank you for watching.